Gold participants and listeners from around the world. I'm Kristin Schwartz, licensed midwife and MC here at Gold Learning. And today in our podcast series, I have a very special guest. And today with me is Dr. Kristin Tully. Hello, Kristin.
Hi.
It's so good to have you here.
It's an honor to engage with you all.
And you are one of our speakers here at Gold for the Gold Perinatal Online Conference of 2019. And we'll get to that in just a little bit. But first of all, let's start with where are you located? Where in the world are you located? We have an international audience. It's always nice to know where our speakers are from.
Yes, I'm in Chapel Hill, North Carolina, which is on the eastern side of the United States.
Wonderful. Thank you for sharing that. So we are here at the coming up shortly, the Gold Perinatal Online Conference, where you will be presenting. And your topic is the fourth trimester, establishing the care that families deserve in their transition to parenthood. What an important topic. And I'll get to that in just a little bit. I'm really excited that you are presenting on that. It's actually a topic that I find very important and I'm very glad that this is being highlighted in this conference, and we get to that. But before we talk about the presentation itself, can you tell us a little bit about yourself and your professional journey?
Sure, thank you. I have a doctorate in anthropology, and I worked with Professor Helen Ball in England at Durham University to do that. And anthropology is about people, understanding what it means to be human, and what sort of environments enable us to achieve our health goals, and thinking about what's biologically normal, which is often very different than what is common in our societies today. And so thinking about those mismatches around mom and baby needs and how we can recognize those and then be more accommodating is sort of what I'm all about. And so I'm at the University of North Carolina at Chapel Hill in the Gilling School of Global Public Health. And I have done postdoctoral work at Duke University in the School of Nursing, through the UNC Center for Developmental Science. And so this is a really exciting journey to be on in a community of maternal and child health advocates and researchers and practitioners, because mamas matter too, and so we really want to enable families to thrive. And I think that means changing systems of care, so that we not only provide more education and more realistic planning, but also take care of them, structure care to be more validating, more holistic, and more effective.
Wonderful. Thank you for sharing that. So you are an anthropologist. When did that topic of moms and babies and postpartum development and care, when did that become a research interest for you? Was that right away when you started off in your career that you said this is really exciting, or was that a development?
Yeah, well, this is just a fascinating story again about, what it means to go through the life course. And so I had the great privilege of being introduced to this field and its many complexities as an undergrad. I was at the University of Notre Dame, which is in Indiana in the United States, and got to learn from and continue to collaborate now over the years with Professor James McKenna, who probably many of those listening have had the pleasure to learn from and think with. And so mom baby sleep was sort of the foundation for my journey, ongoing work and thinking um, around the fourth trimester, because that's a good example of how our health needs intersect. If you think about nighttime infant care,
Yeah,
including breastfeeding, and then sleep needs, and how those influence each other, and how our thinking about those
yeah,
impacts not only what we do, but also, how we study these things. So it's just really fascinating.
absolutely. And you, if I'm correct, correct me if it's not if I don't have the right information here, but you did a study on nighttime infant care, right? And on the sidecar bassinet.
Yes, and that's a little bit in this presentation.
Mhm. Good.
So sidecar bassinets are three-sided bassinets in the hospital that lock onto the maternal bed frame. And so while I was doing my doctorate in England with Helen and colleagues, um, those were commercially available. And so we utilized those in the context of a randomized controlled trial, building on work that Helen had done with women who had vaginal deliveries. Then I worked with moms who were scheduled and underwent cesarean section. And it's a great example of how the environment impacts our interactions and thereby our health experiences and outcomes. And so, access to babies matters, and there's a striking lack of innovation in maternity care. And so, that's part of the story in this gold talk, but also it's a lot of the on. It's I think a central theme
Hmm.
in my program of work is, what are unmet health needs, and how can we um, fix those together. And sometimes that means, better communication and information, and other times that is altering the environment. And in this case, having a bassinet that you can see and reach your baby. So it's
Yeah,
not that complex, but getting it um, as part of, the standard of care, that's a whole culture shift. Um, and so that's what I try to do.
that's absolutely wonderful, and we're looking forward to this presentation. And I absolutely love the title, the Fourth Trimester Project, how you titled that. It feels like postpartum, the transition is like a fourth trimester almost. We focus so much as healthcare providers and birth workers on pregnancy and everything that goes on. And it often feels like these mamas and families and birthing persons after the baby is born, it's almost like they fall into this kind of vacuum and adding this fourth trimester, so to speak, into the model of care makes a lot of sense, right?
Yeah, you know, motherhood and parenthood and family life, that's a developmental process. And Dr. Sheila Kitzinger was an anthropologist who came up with this term decades ago. And it's been exciting with my colleagues, Drs. Sarah Verbees and Allison Stubbe here at UNC Chapel Hill, to be part of working to have this concept of the continuum of needs, not only of infant development, but moms and caregivers too. And so Dr. Kitzinger wrote that there's a fourth trimester to pregnancy, and we neglect that at our peril. And so it's been deeply felt by many, this gap in care. And as Allison Stubbe says, it's as if mom is a wrapper, and once the infant is born, the wrapper is cast aside, and that is not acceptable.
Absolutely, absolutely wonderful that you are presenting on this as well. Liz. Now, before I let you go, my last question here is, what are you hoping that the delegate will take away from you? What do you think is one of the key points that you hope to bring across?
Well, I think this concept, just the fourth trimester, I think it's helpful as we've sort of been discussing for focusing attention on a postpartum period and how critical that is. And
Mhm.
so, therefore, we should, get upstream of that and be thinking not only for safe and satisfying deliveries and all of the work that and excitement that goes into that, but also for enabling wellness in this transition period, because it matters, how you are cared for, how you feel seen, um, on every level.
Absolutely, it matters so much also for the bonding with the baby and the developmental stages there as well, and for the entire family. Well, Dr. Kristin Tully, it was a pleasure talking with you here today. Thank you so much.
Thank you. This is wonderful.
And now to our listeners, this presentation, the fourth trimester project, establishing the care that families deserve in their transition to parenthood by Dr. Kristin Tully, will be live on October 7th. And as I mentioned before, is part of the Gold Perinatal Online Conference of 2019. Please check out the website goldperinatal.com. You will find information there on this presentation and also on all the other presentations in the conference. We have over 14 hours of education. We have a wonderful opening keynote that is open access by Sarah Buckley, not to be missed. And so go to the website, find out more about all the presentations and when the presentations are live in your time zone. And hopefully we see you all there. Bye bye, everyone.